So most people are looking for a breast lift if they've had pregnancy, children, kind of had some gravity issues over the course of time. Some people have gained, lost weight, and now have just extra skin of their breast. And so what we're going to be talking about mostly with our lift consultation is what type of lift you're going to want and if you're going to want an implant with your lift. So as you filled out your preoperative paperwork, we asked you what size breast you are now and what size you want to be. And so that doesn't need to be an exact thing because cup sizes are different, but we just want to have a good feel. Are you wanting to go down? Are you wanting to stay the same? Are you wanting to go up? Because that's going to determine what we're going to need to do. In general, with most lifts, if we're just doing a lift to your breasts are going to look about a half cup size to maybe even a full cup size smaller, depending on how much extra skin you have. Additionally, if we're just doing a lift, you may have that teardrop kind of slope shape to your breast, which is a very natural look and what most of our patients do want, but some of our patients do want a little bit more of that upper pole fullness. And that, unfortunately, is not really achievable with just a lift and gravity and fat as it exists then. So for those patients that are really wanting that fullness right up in here, we may talk to you about maybe adding on an implant or some fat grafting to your lift case. In most cases, people who really want that upper pole fullness are going to pick an implant because fat acts like fat and can also drop into that more teardrop shape. And so really start to think about what shape of breast you're wanting. We'll also talk to you about the scars on the breast. So there's different types of lifts, and we will link another video down below that you can see, and that will go over the 3 different types of lifts, whether you are a periareolar candidate, a vertical scar candidate, or a full anchor scar candidate. There's also another type of breast lift that doesn't involve that front-facing scar, and we can talk about that and the reasons why or why not you might be a candidate for that. Also with the breast lift, know that we can do an auto augmentation lift where we really rearrange some of the tissues inside of your breast to make a nice round breast, or if we're just kind of needing to lift things up a little bit without really reshaping the tissues. And we'll talk to you about what you're a good candidate for. So after we talk about some of your goals and kind of go over your medical history, make sure that you're a good candidate, we'll ask you to put on a gown. We will then come in and I will take some measurements of your breast. That's going to help kind of direct me into what direction we're going to need to go as far as your lift and what you're a good candidate for. And then we will show you some of the different scar patterns or what have you that will look good in a breast lift. So before you get changed, we're gonna take some quick pictures of you. Then we'll let you go ahead and get that changed. And I'm gonna come in and analyze those pictures using this TouchMD app. And we'll be able to show you what asymmetries you have right now, show you kind of what scars to expect, what limitations or what good things that we can do, and give you a good idea of what to expect after surgery.